Welcome. This is your YouTube review video for PowerPoint 8A, which is the beginning of joints, for which you should have a short quiz next week before we leave for holiday. The more technical name for a joint is an articulation. So we've used that word with articular cartilage. I've used that word, so that's a word you should be comfortable with. An articulation or a joint, hopefully, obviously, is a place where two bones meet. This allows us to, unlike the Tin Man in the Wizard of Oz, allows us to a great degree of mobility. There are three anatomical divisions to joint types that you should know. There are fibrous joints. The best example of that is a suture that we've mentioned and examined in the skull. There are cartilaginous joints like the symphysis we studied in between the pubic bones in the hip. And there are synovial, many types of synovial joints. These are the majority of this chapter will focus on synovial joints, which are the extremely movable joints like the hinge joint in the knee, the ball and socket joint in the hip that we will study following. All right, first up is fibrous joints. Again, we can think of these as immovable joints. There is no movement at a fibrous joint, and one example of that I would like you to know is the suture, what you find in the skull. So here's our example, bones in the skull. You have tight connective tissue fibers linking the bones together. They allow for some expansion as your brain grows when you're developing. As you get older, these bones fuse, again, like the ilium, the ischium, and the pubic bones fuse. Your skull plates fuse. And again, these are sutures. Cartilaginous joints obviously are in between the two bones. You have cartilage. There is still no joint cavity. Sutures as well have no joint cavity. And there are several examples, but the example I would like us to know is the symphysis, which you find between the pubic bones. Between. And intervertebral joints as well. So in between the vertebra of the backbone, you have cartilaginous discs. And again, we mentioned, I'll give you a quick hip bone here. So we know in the junction here, there is a symphysis or a piece of cartilage which joins these two bones together. And again, this joint here actually allows for some movement during pregnancy, for the magic of birth there. The rest of the slides in this PowerPoint and the following one, 8B, will deal with synovial joints. Synovial joints are defined as freely movable joints that contain a joint cavity filled with fluid. These are the joints where we commonly think of when we think of a joint. Again, your hinge joint, your ball and socket joint, pivot joints. This is a coloring sheet, a diagram you should be able to label these parts and their functions. Most of these functions deal with either the fluid and lubricating the space between the two bones, or deal with structural support, binding the two bones together, preventing them from flying off into space, for example. So we have articular cartilage, which we're familiar with. This is cushioning. The joint cavity itself, in this joint cavity is the fluid. This fluid is lubricating, which again kind of cushions any friction that might occur between the two adjoining bones. I think, do I have an eraser? Which I can't find. I think what I want to use, instead of using a bunch of different terms here, the general function here is to reduce friction, which is what a cushion does. Fibrous capsule supports the joint. This is connective tissue which ties the bones together, as do the ligaments. And the membrane, this is epithelial tissue that creates the synovial fluid, which reduces friction, much like oil in your car, between the two moving bones. Okay. Here is a diagram. We follow two long bones that connect at a joint, and the capsule and cavity that exists in between them. We know what the periosteum is. A ligament is this is dense, regular connective tissue that connects the bones. The ligaments we're probably familiar with are those in the knee, like the ACL, the MCL. A cavity, and in that cavity there is friction-reducing fluid. Cartilage, the periosteum, which becomes articular cartilage at the tip of the bone. At the end of the epiphysis, again, functions as a cushion. And the capsule, which related to the ligament, also structurally ties the bones together and binds them together tightly. Again, this fluid is produced by the synovial membrane, which, if you notice, is continuous with the articular cartilage as well. Additionally, in complicated joints like in the knee or the elbow, you have what I think of as small pillows that you place in between two areas where there's a lot of moving parts. These pillows are called bursa, or bursa singular. These are little pillows filled with synovial fluid, which again, the goal here is to reduce friction in a joint where there's possibly many ligaments, muscles, bones all coming together, like in your shoulder, for example, where you need some additional friction-reducing agent. That's a bursa. You can see here in this inset picture, so we have a little pillow that's inserted here between the bone and the ligament from another bone to further reduce friction. You might have heard of bursitis, which is inflammation in a bursa due to repetitive use. A pitcher, for example, who throws a baseball with a lot of effort, repetitively and frequently, again, you have problems, especially in the shoulder joint, potentially. These terms come up as origin and insertion. When you have movement at a joint, if we imagine this is your humerus, this is your radius, in between you have your bicep. It's a weak muscle. No, I meant my drawing, not the bicep itself. When you flex this joint, this elbow joint, and the forearm moves towards the humerus, we say the insertion, which would be the further point of the muscle, moves towards the origin, which is the anchor, if you will, of the muscle. So any muscle must attach by almost any muscle must attach by two points. The further point is considered the insertion of the muscle. The anchoring point is considered the origin of the muscle. You should know that. All right, the rest of this PowerPoint deals with the various movements that occur between different types of synovial joints. The most limited kind of movement is termed the gliding movement, and it's what occurs in between the little marbles in your wrist and in your foot. This movement is almost unnoticeable. It's not a waving of the hand or a turning of the wrist, but it's literally like if you had a bag of marbles and kind of rub the bag and move the marbles over each other. This kind of movement is almost unnoticeable. A gliding or slipping motion, which again is almost unnoticeable as you use your wrist in daily usage. So this is the most limited kind of movement, gliding movement or slipping movement that occurs at an intercarpal or intertarsal joint, which is synovial. There is a joint cavity. There is fluid in between there, those bones. These angular movements are bigger, more dramatic, more visible in space, usually come in paired movements, flexion and extension, which commonly occurs at the elbow and at the knee, and also in your phalanges. Dorsiflexion and plantar flexion, which are movements at the angle of the foot. Plantar flexion is in essence standing on your toes. Dorsiflexion in essence is standing on your heels. Abduction and adduction, which are moving your arms or your legs. The easy example is your arms. If you were to stand still, take your arms and move them in the frontal plane away from your body, raising them at the shoulder, and then moving them back down for adduction. I usually teach abduction as if you're being abducted by your aliens. Your arms are going up and out. Adduction, D for down, is when the arms or the legs move back down to the midline in the frontal plane. Circumduction, movement of which occurs only at a ball and socket joint. The movement of the arm or the leg in a cone-shaped pattern. You have pictures which indicate these movements. I would also recommend on Moodle posted is a video done by 2 students a number of years ago, set to a catchy tune where they demonstrate some of these motions. You can see here the arm moving towards this woman's head in this first example here, which is flexion. The knee flexing backwards, also considered flexion. Extension will be returning the leg to its position, or in this case, returning the arm down to its normal position. Flexion reduces the angle between the 2 bones you're moving them against, and extension increases the angle between the bones. In this case, you're further going beyond that original position, and you're extending the arm. This would be the opposite motion to this first picture here. If you go beyond 180 degrees, that is hyperextension. When you make a bow, that's flexion. You can do the same thing at your neck. This is unlabeled, but this first one is dorsiflexion. And this movement is plantar flexion, as in planting your toes. I think you can see here what I mean about abduction and then adduction. You could do the same motion with your leg as well. Circumduction, rotation, which occurs only at pivot joints. So here the head is rotating, rotation of the leg. Supination and pronation, these are movements in the forearm. Supination, if you were to turn your hand anteriorly or superiorly as if to receive a bowl of soup. Pronation is the opposite of that, as if you were to, I guess, take the bowl of soup and turn it over and dump it on the ground, I guess because you did not like it. Inversion and eversion are turning at the ankles. Inversion is turning the ankles inward. Eversion is turning the ankles outward. Protraction and retraction can be demonstrated with the mandible or with the shoulders. Protraction is moving one bone in front of the other, and retraction is moving one bone behind the other in the same plane. Elevation and depression again can be demonstrated with the mandible and with the shoulders. Again, I believe there are pictures following that show this better than I'm speaking it. Opposition is done with the thumb. Sometimes you'll hear that we're unique and that we have an opposable, primates are unique in that they have an opposable thumb, unlike your dog, for example, who cannot catch a ball thumb. You can see here supination and pronation demonstrated. Bowl of soup versus prone, or turning the hand down. Inversion versus eversion. Protraction and retraction. Well, that's a good look. Elevation and depression, and you can do the same when you hunch or droop your shoulders. And opposition. Peace. Good luck.